Colleagues, today I rise in support of House Bill 2339, which addresses balanced billing, or surprise billing, and its attempts to deal with the problem that emerges for consumers when they inadvertently see a provider through no fault of their own that is out of network. What am I talking about? What do we mean by balanced billing or surprise billing? Most of you know that insurance plans have different rates for in-network and out-of-network providers, unless your healthcare provider and insurance plan are combined, like Kaiser, where all their providers, by virtue of their setup, are in-network. When your medical provider is in-network, it means that they have contracted with your insurance company to accept certain negotiated rates. You, as a patient, will typically pay less with an in-network provider. Out-of-network providers have not agreed to the discounted rates, and thus, if you choose to see an out-of-network provider, you will pay the additional part of the cost that the insurance is not covering. This bill addresses the problem when, through no fault of your own, you see an out-of-network provider, and then you are subject to balance billing, and you have to pay the difference in cost out of pocket between what the insurance plan pays for in-network and out-of-network services. We all expect that when we go to the doctor or we have a needed medical procedure done and we go through all the steps our insurance requires, it will be covered. But right now, it is possible for an Oregonian to go to the doctor covered by their insurance for a non-emergency medical issue, have a procedure done that is also covered by the insurance plan, and then end up saddled with a massive bill because the radiologist or the anesthesiologist that assisted with that medical procedure was out of network and nobody ever told the patient. Unfortunately, this is more common than you might think, which is why we have this bill. Here's an example. During the interim, I started working on a bill that would have been similar to House Bill 2339. I was approached by a constituent who went to his provider, a doctor, for a minor surgical procedure, and he wound up owing around $8,000 after it turned out that his anesthesiologist, through no fault of his own, was out of network. That's a lot of money, especially for something that's unplanned. At no point was he consulted or warned that something like that could happen to him. Most of us don't have $8,000 lying around for a surprise medical bill. That's why we need House Bill 2339. Now, while in committee, this bill was the subject of some debate. I acknowledge it was not moved out unanimously as amended, though I believe there was broad consensus that balanced billing is a problem, even if we disagree on the proposed solution. I don't hear anyone suggesting that patients should be culpable for decisions made by providers without their full understanding or consent. So here's the thing. House Bill 2339 would protect patients by requiring that the insurer and the healthcare service contractor, not the patient, reimburse out-of-network service providers at 175% of the Medicare price. Why did we choose Medicare over other reimbursement benchmarks or approaches? The median amount negotiated for services, I'll tell you why. The Department of Consumer and Business Services, which administers insurance law, did not want a solution that created a significant administrative burden on all the parties involved. And one of the approaches that we considered would have done that. Medicare is a well-known, accessible benchmark that is updated annually by CMS, which stands for the Centers for Medicare and Medicaid Services. Medicare rates are transparent for all the parties in the healthcare system. Medicare must account for differences in procedure types and geographies. By pegging reimbursement to Medicare, providers are still getting paid a fair rate for the services that they provide to patients. The bill also adopts the out-of-network emergency services reimbursement rate that conforms to the Affordable Health Care Act. Emergency care would be paid for at the greatest of one of the following. Here's the part I started to read too early. The median amount negotiated for services between the insurer and the participating providers, less than a consumer cost responsibility, the established out-of-network reimbursement rate, less than a consumer cost responsibility, the amount paid by Medicare for some or similar services in the same geographic area. That's what the bill does. And with that, colleagues, I hope you'll support House Bill 2339 and help end the practice of balance or surprise billing.